a 3-day party pack. Last year was great, but it's gonna be super this trip. Friday, 6th September, all white old school vibe with the evergreen Closec band, where we'll relax ourselves and pamper our ears with some good old school music. The time is 6 p.m. till we drop. Saturday, 7th September, where my reggae lovers. It's a reggae night with Closec band featuring Ras Alfred and Ras Weezy. You can't miss out on this great experience. On Sunday, 8th September, who lifts the title, Pim Pamsia Football Gala, as the Accra Kwabo Trio Gasco National decided, Agwe Memorial. Come and cheer your favorite team up. The children's playgrounds will be in session with bouncy castle, trampoline, face painting, and many other fun games. With popcorn on the side and it's free for all. The time is 10 a.m. to 6 p.m. Bring all children to have great fun. And there's also going to be special club night on Friday and Saturday night with DJ Master Flavor, DJ Fingers, and DJ Effects all the way from the UK. Come and let's party in grand style. For more inquiries, call us on 030-396-0345 or on 056-151-2407. Pim Pamsia Hotel Afeshie Beer Festival. Don't miss out. This event will be broadcasted live by Claw TV.
There is no beer. That is why we be drinking all the beer.
Clog TV. Beyond the policy.
Yeah, welcome back to the Cocoa Digest Morning Show. If you're just tuning in, this is the Cocoa Digest Morning Show, and we're about to have our main discussion. Today, we'll be talking about prostate cancer, understanding the risk, the symptoms, everything about prostate cancer. And with me here today is a familiar face. She is in the person of Dr. Victoria Partey Newman. She was here a few weeks ago to talk to us about hypertension and diabetes. Today, she's also here to talk to us about prostate cancer. So, of course, I will definitely read a bit of her profile to you. So, she's a resident public health physician at the West African College of Physicians and Surgeons. So, let us get acquainted with our beautiful doctor here. Good morning, Doc.
Good morning.
Thank you so much for joining us here once again, and I hope you are doing well.
I'm good. How about you?
I'm also fine, thank you. So today, they say we should discuss prostate cancer. So first of all, I would just like to ask, what is prostate cancer then?
Okay, so like any other cancer of any other part of the body, we have breast cancer, we have ovarian cancer. Prostate cancer is cancer of the prostate. So now I would ask, what is the prostate? So the prostate is a gland in the male reproductive organ, and it's usually below the bladder.
Okay.
The bladder is what carries the urine in the urinary tract system.
Yeah.
So it's below the bladder, just above the urethra. The urethra is a tube that where the urine passes through the penis.
Yeah.
So just above the urethra, below the bladder, is the prostate gland. And the use of the prostate gland is it produces seminal fluid, which nourishes the sperms and also helps with transportation of sperms.
Okay.
Usually, the body has been programmed in a way as to reproduce cells. We call it mitosis and meiosis. So what happens is when there's something, when it goes off the normal, it causes the number of cells and the turnover of cells. When we say turnover of cells, how long the cells stay or die. It's supposed to be short, but when they become cancerous, they stay for a long time, and then they turn into other structures, and then they end up evading the structures around the lymph nodes and the bladder and other structures around the prostate. Then we would say that we are having prostate cancer. Sorry.
So let me quickly chip this in. This is going to be a very educative segment. So Don't forget to send in your comments and your questions to our Facebook and YouTube live stream. Call a friend, text a friend to join the live stream to learn something and be informed. Don't forget also to send in your questions and comments to our WhatsApp numbers, and they'll be displayed on your screens as well. The phone lines will be opened for you to call in and ask your questions. So let us get back into it. So what are some of the risk factors of prostate cancer?
So like, it's similar to breast cancer.
Okay.
There is no definitive cause for prostate cancer. Like, for example, would say if you have malaria, the female Anopheles mosquito cause malaria. With prostates, there is no definite, but there are risk factors, things that can push you to that predicament. So one of such is by virtue of your age. As a man above 45 years, you should start checking for your PSA level, the prostate specific antigen level. It's a test that is done annually to check the level. The levels, we have different levels for per age. So between 40 to 45, between 45 to 50, 50 to 60, 60 to 69, there's supposed to be some threshold of PSA in your blood. So we take a blood sample to check, which is very important. Yeah.
So prostate cancer is limited to just men, right?
Yes, please.
Okay. So, yes, about the tests, I know, let me just ask.
I think we are not done with the risk factors.
Okay, Then let's finish with the risk factors. So you mentioned the PSA.
Age. Yes,
the age.
The age, and then also race. So usually,
Okay, before you continue, the PSA, can you quickly just give us the range? Something like breast cancer, young ladies are told to start early, massages here and there to check in case of anything. How early should a man start checking himself?
I think if you are my husband or brother, I would suggest by 40.
By 40,
yes,
okay. So minimum should be between 35 and 40.
Yes.
You should start checking. So what is the range of the PSA, maybe from 35 to 40 or maybe from 40 to 50? What is the normal range, and then what's the alarming range then?
Okay, so there are specific ranges which I don't have.
You don't have them off it. Oh, okay, that's fine.
But when we get a PSA, just like say for a man who is like 64, his range is supposed to be between 2 to 5. Okay. So if we are getting like 6, 7, then we know there's a problem. So it depends on the values.
Okay. So then let's go back into the risk factors. Yeah, so if you mentioned the age and then the PSA, what else are some of the risk factors?
So by race, the black race, the American, Afro-Americans, we Africans, we are at risk more than the Caucasians. And then also family history. If your uncle, your brother, even if your mom has also suffered from breast cancer, you are at risk of getting prostate. Yeah, because it's the same gene that causes the prostate, the BRCA1 gene and BRCA2 gene. Yeah, so you're at risk of it. And also smoking, alcoholism, obesity, eating a lot of fatty diets puts you at risk of prostate cancer.
Okay, so your diet and lifestyle.
Very important.
So can you quickly let's talk about the symptoms. How do you know there's something wrong with my prostate?
Okay, so usually men usually have issues with their urination. So they would come in complaining of a strong urge to urinate. Sometimes they would even pee on themselves.
So incontinence.
Yes, urinary incontinence. Also, they come in with frequency of micturition. Urination. Urination. So it's more like they can in the night they can pee more than 4 to 5 times. And then also sometimes there will be blood in the urine. That's hematuria. Sometimes even in the sperm, the semen, there'll be blood in the semen. Sometimes you'd notice pelvic pain, abdominal pain, waist pain, bone pain can also be factors, symptoms of prostate. And then erectile dysfunction. Your performance is not as it used to before. You should go to the hospital to check. So I think anything petty concerning your urinary tract as a man, If you keep having frequent, even UTIs, should prompt you to check your PSA.
Okay.
Yeah.
Okay. So how does the screening and diagnosis work?
Okay. So a gentleman comes in complaining of increased frequency of micturition. Sorry for using micturition is the same as urination.
Okay.
So increased frequency of micturition, urinary incontinence, and then even dribbling of the urinary stream, as in the urine doesn't come straight. It's just, kind of like it's narrowed and it's dribbling. And usually when it happens like that, the first thing we do is to do a digital rectal examination.
Okay.
So we let the patient lie in a position whereby we lubricate the index of your finger wearing a glove, and then we enter the rectum. The prostate is adjacent to the rectum. So once you enter the rectum and you turn your hand, you would feel the prostate. There you are going to look for the size of the prostate. Aside prostate cancer, we have something we call benign prostatic hyperplasia. That's BPH, which is not cancerous, but also presents with symptoms, like I said, like obstructive symptoms, not able to urinate, dribbling of urine, streamlined urinary passage and all that. Those ones is the BPH. So you check for size, you check for texture, if it's hard, and you check for consistency, and then you are able to know, okay, now that this is, it's very rough and hard, that's more cancerous. From there, you would request for the PSA levels. So there's a range that you're supposed to have. Based on the range, then you would know, okay, let's do a prostate biopsy. So then the surgeon comes in, and then through a ultrasound, guided transrectal ultrasound, we are able to do the biopsy, where we pick up tissues from the prostate, and under microscopy, you look and then see which ones, whether it's cancerous or not. And then after finding out if it's cancerous, we then have to grade in terms of aggressiveness. Yes, how aggressive is it? How fast is spreading? And then we look at the staging. Staging whereby stage 1 is where the prostate cancer is confined within the prostate. And stage 2 is the prostate has 2 lobes. So you notice that the prostate cancer has spread to both lobes bilaterally. And stage 3 has to do with spreading bilaterally to both lobes with the lymph nodes and then the seminal vesicles. Stage 4 has to do with spreading and metastasizing to the whole body, the lungs, the bone, and the chest and all that. Yeah.
So you mentioned the exam, and I know that a lot of men have an aversion to anything regarding the anal area. So something like this, how do we encourage or convince more men to get tested? Or I'm trying to find the right words. Isn't the test invasive, so to speak?
So usually this is more theory, medical school, DRE and all that. But practice-wise, when your patient comes above 35 to 40 and beyond, you do a PSA. When the PSA results come and it's high, then you refer to the urologist. The urologist handles the patient, discusses with the patient that would have to do maybe a biopsy, or probably some very experienced surgeons sometimes do not do the DRE. Yes, but sometimes you would have to do. But through the ultrasound biopsy, you're able to see actually what is going on with the prostate. Also, you can use magnetic resonance imaging, that's MRI, which is very, very detailed to see how the prostate is looking. So most people seem to want to avoid, as you are saying, but when it comes to your health, you just have to be so obedient to your doctor. But
so with regards to that, knowing that it is seemingly invasive, probably even traumatic for some men, or even most of them, is there any sort of psychological coaching before such
Yes, even in medical school, it's one of the things that you can be failed on. If you are giving an exam, clinical exam, do a DRE, first and foremost, you inform the patient. You make the patient agree with you, or come to terms with that. And the patient will ask a lot of questions. You should be able to answer within your time frame. So you should be able to convince your patient that you want to do this procedure, and then explain that after probably there'll be pain. Sometimes there can be a little blood and all that because it's invasive, as you said. And then you'd go ahead to do the procedure.
So in a situation where the MRI is expensive. DRE too is invasive. My body, my choice. What will be one of the best ways for the patient and the doctor to come to an agreement and then be able to move forward?
So, like I said, a transrectal ultrasound.
But even with the ultrasound, it's still something going to be put up there,
yeah,
right?
but it's not expensive.
Okay, but I'm trying to ask that in a situation where the client does not want anything up his rectum, but cannot afford the MRI, what then is the way forward?
That's the only way, because eventually, if there's prostate cancer, we would have to do a prostatectomy. That's removal of the prostate, which is still invasive.
Yes. So can they also do maybe CT scans or like the one for the ladies with the?
That's the ultrasound.
Gel. Okay.
That's the ultrasound.
So no, on the bladder, like on the skin, instead of.
That can pick up something,
but not.
But it won't be that detailed.
Okay.
Of course, you can do an abdominal scan. You'll be able to see the prostate. Fine. But when it looks like questionable, then you need to do the biopsy, like I said.
Okay.
So we can't do that anyway. But it's a bit inconclusive.
Okay. Okay. So the biopsy too, is it painful?
You with anesthesia.
Oh, okay. So
yes, so it will pain you after the procedure. Probably you might even have delayed urination, whereby they would have to use a catheter to pass through your urethra to be able to have urine come out.
Okay. So, my dear cherished viewers, especially to you, the men out there, yes, the DRE is uncomfortable, but your health should be your first and foremost priority. So ask every question you need to ask so that the doctor can explain to you, and then maybe the traumatic experience can be reduced a little for you. Your health should be your priority. Don't think about the discomfort. Think about the longevity of your life, preserving your life. So, yes, you mentioned the staging. So let's go to treatment options. What in a situation where, yes, okay, no, we haven't been talked about the benign and then the malignant ones. So when it's benign, do you still proceed to take it out? Or?
If it's causing symptoms, because some of them enlarge. That's the benign prostatic hyperplasia. Hyperplasia in the scientific word meaning hyper, more. So plasia is growth. So big, the prostate enlarges. When it enlarges, it obstructs the urethra, so urine can't flow. And you always feel you haven't emptied your bladder. It's quite uncomfortable. Even though it's not malignant, you still need a surgery. And also, before the surgery, we have medications that can also reduce the size of the prostate. Yeah, we have finasteride and tamsulosin. Those are medications given for BPH to reduce the size of the prostate. And then if with that it's still giving problems, then they have the surgery.
So are there any illnesses that are risk factors to prostate cancer? Like the way we know that, if you have hypertension, you are likely to be diabetic, or if you are diabetic, you are likely to be hypertensive. Are there any diseases like that?
Yeah, so with prostate cancer, they usually end up having issues with erectile dysfunction. Even after the prostatectomy with removal of the prostate, they still have problems with that, but that can be managed with medications. Yes. So
it's not like if you are diabetic, you are likely to become. There's nothing like
it's quite independent on its own.
So let's go into the treatment options. What are some of the treatment options that are available?
So we have the surgical treatment. And number one, the treatment options is based on the staging. So sometimes the doctor can combine surgery with radiotherapy and chemotherapy. Sometimes the doctor would say, okay, let's do active surveillance in the sense that they don't want to go invasive. They observe with time more DREs, more PSA tests, and then frequent visits to the hospital, especially with people that are chronically ill, and the surgery might be a bit traumatic for them and might put them in deterioration stage. They usually do more of active surveillance And then if they're able to know the staging, for example, stage 1, we could just do radiotherapy and then probably kill the cancer cells.
Okay.
Sometimes we have this procedure, we call it brachytherapy,
Okay.
which usually a seed-like radioactive substance, like a rice, like the size of a rice, is placed in the prostate through ultrasound guidance,
Okay.
and is left for days, 1 or 2 days, and it kills the cancer cells.
Okay.
It's very, very effective, but very expensive. Yes. And then we also have the prostatectomy, that's the removal of the prostate. We have the aggressive radical prostatectomy. That's when there's like the staging has gone far, like stage 3, stage 4. They have to remove the lymph nodes and some surrounding tissues with the prostate. Yeah.
Okay.
And then we also have chemotherapy, where we have to take some medications to kill the cancer cells.
Okay.
So it's quite a very, should I say, very demanding treatment, in the sense that it weighs you down. You need a lot of support. Like the way breast cancer, you need a lot of support. Likewise with prostate cancer.
Okay.
And the funny thing with prostate cancer, it can be so gradual. You could be diagnosed, and in 5 years you'll still be alive.
Okay.
But then when after 5 years, the decline of your health, it goes so fast that within
okay.
a short time, then you are dying.
Oh.
So it's something that you should take note of. And one thing I would put it out there is, when you check your prostate and you are comfortable with it, it doesn't mean that's the end of it. Check it every year.
Okay.
Don't forget annually to check your prostate, because you could be good this year, and
then
within
next year.
the next 6 months to 1 year, it just skyrockets.
Okay.
And also, one thing I've noticed is that PSA levels being high doesn't necessarily mean that it's prostate cancer. It could
Okay.
be inflammation of the prostate, that's prostatitis. It could be just random infection, you know, which when giving medications to go. So around the time of the infection, PSA levels could be high.
okay.
And also, when you've had sex with your partner and you immediately do your PSA levels, it could also be high.
Okay.
So usually when you want to do PSA tests, you're advised to stay away from sex for like 2 days before you come to do the test.
So yes, even about the sex thing, we see a lot of posts from online doctors that I think something about a man needs to ejaculate about 21 times in a month to keep his prostate healthy. Things along those lines. How true are such bits of information?
Well, I haven't really gotten any theory to back that, or should I say scientific, but people have other, you know, disciplines in medicine, like this naturopathic, homeopathic, they have their own theories. But in terms of orthodox medicine, not having sex for a long time or requirement of ejaculations over many times reduces prostate cancer. It's not true.
Okay, so we even have a question here. I think it's similar to mine, but I'll read it. This one is from Amin Isahak. He says, I was told that constant sex and masturbation can help in treating prostate disorders.
Okay.
So it seems this is something going on out there, that, you know, frequent sexual activities would keep your prostate.
You know, it's so
gland
funny that you just want to get an excuse to always, you know, do something which is like over the board.
Okay.
So probably it's just something to, you know, kind of like justify themselves for what they are doing, because scientific medicine-wise, orthodox, there's nothing like that.
So then someone who has been celibate for years is equally as at risk as somebody who has been active.
Active, exactly.
Okay, so please don't be misinformed. So yes, there are some cancers that are hormonal, right? And then some aren't. So with prostate cancer, how would you even determine that it's hormonal or not?
Yeah, so with prostate cancer, that's why I said after doing the biopsy, you need to do the microscopy to pick up what type of cancer cells you're dealing with. And then you know whether it's aggressive or not.
Okay.
In picking up the types, you would also pick up whether it's related, is hormone related or not. Hormone related meaning that the male hormone, the testosterone, are exacerbated.
Okay.
And it can, you know, kind of trigger more of the prostate
Okay.
cancer cells to multiply. Usually what happens is that the men are surgically castrated,
Okay.
removal of the balls, so that it reduces the it reduces the hormones,
Okay.
and it really helps with the progress of the prostate cancer, in the sense that the figures just drop. My father-in-law had prostate, so I had an experience with him.
Okay.
So you realize that when it was that, but he was very old. He was like 85 years
Okay.
old. Yeah. So when it was removed, we went to do the test, the parameters, the figures dropped drastically because
Okay.
his PSAs were in the thousands.
Wow.
So it dropped to almost like 50, 40, and it kept. So it showed that his cancer was really hormonal, strictly.
Okay.
Others are different. It could be another type of cancer.
Okay.
Yeah. So it depends on the type of cancer.
So, with the way African men cherish their testicles and their genitals, telling an African man that we may have to remove your family jewels, if he is not in favor of that, what is the alternative?
Usually, we have medications
Okay.
that suppress the hormones.
Okay.
Yeah, but you know the funny thing, when your hormones, the testosterone are suppressed, you start projecting female characteristics.
Okay.
Yeah, it's going to have issues with breast enlargement. That's the gynecomastia.
Okay.
You're going to have low sex drive, libido, and even sexual performance. Yes. So whether you are surgically removed or medication-wise, it's still going to have an effect on you.
Okay.
So this prostate thing really affects the male ego.
Oh, yeah.
It's a big deal. It is. But you know, the funny thing is your life at risk, because whether you have your good male ego or not, you're gonna die. So which one would you choose?
Yeah, that's true.
Yeah.
So when the testicles are surgically removed, are there any artificial hormone supplements given to them so that it checks the female characteristics?
Yes. Those hormones are given to them, but they should be very keenly managed with an endocrinologist.
Okay.
You can't just give that to them and then they go on their own. Likewise, we have breast cancer, some of them also being hormonal. So when those hormones are removed, the estrogens and other hormones are removed, we have a way of balancing the hormones. They also need to see the endocrinologist. At the end of the day, it reduces the breast cancer and then also the prostate cancer.
Okay.
So it's very important.
Okay. So what's the difference between the radiation therapy and then the chemotherapy?
So chemo is chemicals, medication going into the body, okay? And then radiation is radioactive radiation, like X-ray. We have gamma X-ray. Those of you this science, gamma X-rays, we have X-ray and all that, ultraviolet X-ray. So the radiation is a type of X-ray. And what happens is that part of the prostate is marked, and then the radiation hits exactly on the cells of the prostate to kill it. And the radiotherapy can go about 35 to 45 sessions.
Oh, okay.
Yeah, to be able to kill the prostate cancer cells.
Okay, what about the chemo?
The chemo is taking medications. That's when you're going to have the side effects, loss of hair, vomiting, weakness, loss of weight, loss of appetite. The chemo is very aggressive. Like, normally when a patient is on chemotherapy for prostate cancer, they can't go to work. But sometimes when they are doing radiotherapy, they manage it with work.
Okay.
But with chemotherapy, is very, because there's the foreign body, foreign material entering your body, ingesting something foreign, and your body fighting it. Yeah.
Okay. So which one would you say is more effective? The radiotherapy or the
So like
chemo?
I said, it's synergistically used based on the stage. So if a patient comes and is in stage 4, whereby the cancer has spread everywhere, we need to start with chemotherapy. The chemotherapy, because the cancer is everywhere, so you taking the medication which will work everywhere, and then after some time there's radiation. That's radiotherapy. Then when the cancer cells are hit hard, And then after some time, now we can think of surgery to remove, because the radiation will reduce the size of the tumor. Then after now, we now have to do surgery. So it's a process, and it's interconnected. So we can't say one is above the other. We need all based on the staging.
All right. Thank you. So let's go for a quick break. Our phone lines will be opened very soon for you to call in and send and ask your questions. You can also send in your questions and suggestions to our WhatsApp number that's displayed on your screens, or of course on our live stream on Facebook and on YouTube. We are discussing prostate cancer, everything you need to know about it, risk factors, symptoms, treatment, prevention, and living with prostate cancer. We'll be right back from this break.
Clog TV. Beyond the policy.
Where are you?
I got a 1013. A Vic near Center Street.
Liv! I tried to kill her. I tried to kill Kathy.
Who's he working for?
NYPD. He's the international liaison in Rome.
I want answers. Closure. I need that for my children. I'm just trying to find out who killed my wife.
Upstairs is giving us the organized crime task force. Elliot is not in charge of it.
Who is?
Detective Stabler. Nice to see you again. Our charge is to bust an international drug cartel. I just haven't been able to prove it yet.
I've never met the smart, dangerous, very bad man. I'd kind of like an introduction.
I run a legitimate business enterprise.
And my job is to catch scumbags. There's no doubt in my mind, I know what you are.
Extraordinary accusations call for extraordinary evidence, Detective. Prove it.
I will.
Eli, get inside. Get inside.
We can nail this son of a bitch who did this to your family.
I was a damn good cop 12 years ago. I'm a better cop now. And I will
Kepkus, are you ready? Party time, time to cheer and chill. Pimpamsia Hotel Official Beer Festival is here again. What's your favorite? Club, Star, Budweiser, Golda, Estella? It's a 3-day party pack. Last year was great, but it's gonna be super this trip. Friday, 6th September, all white old school vibe with the Evergreen Closec Band, where we'll relax ourselves and pamper our ears with some good old school music. The time is 6 p.m. till we drop. Saturday, 7th September, we're my reggae lovers. It's a reggae night with Closec Band featuring Ras Alfred and Ras Weezy. You can't miss out on this great experience. On Sunday, 8th September, who lifts the title, Pimpamsia Football Gala, is the Accra Kwabo Trio Gasco National Adisado Agwe Memorial. Come and cheer your favorite team up. The children's playgrounds will be in session with bouncy castle, trampoline, face painting, and many other fun games. With popcorn on the side and it's free for all. The time is 10 a.m. to 6 p.m. Bring all children to have great fun. And there's also going to be special club night on Friday and Saturday night with DJ Master Flavor, DJ Fingers, and DJ Effects all the way from the UK. Come and let's party in Grand Style. For more inquiries, on 030-396-0345 or on 056-151-2407. Pimpamsia Hotel Afeshia Beer Festival. Don't miss out. Those events will be broadcasted live by Clog TV.
There is no beer. That is why we be drinking all the beer.
I just want to take a moment and thank everyone in law enforcement who helped us in the search for our beloved daughter.
There's no point hiding things from me.
You're psychic?
No, just paying attention. I've been watching you and your husband. I understand what you're feeling right now.
You have no idea.
I do. I know.
Did you kill your daughter?
How dare you?
Did you kill your daughter?
Jude, please.
Honestly, it's not as bad as it looks.
Classic Red John smiley face. Drawn in the victim's blood. Clots with 3 fingers of his right hand.
This isn't Red John. In all the previous killings, he made sure that the first thing that anyone sees is the face on the wall. Then, and only then, do you see the body of the victim.
What's that? What are you doing?
Painkillers.
Oh, for your leg.
No, because they're yummy.
Clog TV. Beyond the Policy.
Yeah, welcome back to the Cocoa Digest Morning Show. If you're just tuning in, this is the Cocoa Digest Morning Show. Main discussion, we are talking about prostate cancer with Dr. Victoria Party Newman. And yes, she has been teaching us a little about the symptoms, the causes, all the things we need to know, even treatments. And we have a question here. This one says, good morning. Please help me ask doctor. I have been consuming water a lot, and due to that, I urinate a lot. Any help? Thank you.
Yeah.
So,
so first and foremost, she needs to check her sugar.
Okay.
Yeah, because sugar makes you have polyuria, increased frequency of maturation, and polydipsia, increased test.
Okay.
So she should check her sugar.
Okay. Yeah. So are there any lifestyle habits or how do I, so it's something like hernia related to prostate cancer, or can it have any?
No, hernia, no. But lifestyle habit in the sense,
carrying heavy things like the strain.
No, not related at all. But stress. You know, men, they are people that are stressed naturally because of the responsibility on them, the breadwinner, effect. Yeah. So stress can be one of the risk factors for prostate, and usually when diagnosed with prostate and they adhere to resting and all that with medications and everything, they get better.
Okay.
Yeah, it's one of the main facts. Like problem is the stress, even breast cancer, but mostly prostate cancer, mostly from stress.
Okay.
Like stress, they don't rest back and forth. You know how men, they don't sleep early. My brothers, they hardly sleep early. It's something they do, which is part of them. Okay. But they need to eat well. You take your vegetables, drink a lot of water, exercise, and a usual PSA test annually. Yeah, and puts you ahead. So, for example, let me use my dad. My dad is, my grandpa died from prostate cancer.
Okay.
So my dad knew about it. So he was checking always checking. At that time, I was a med student, so I didn't know what he was doing. When I became a doctor, I used to now help him to check. So a time came that the values were up, we're worried. So now we had to go and do CT scan of the bone to see if it had spread and all that. Yeah. And then by God's grace, it had not. But then it was confirmed cancer in the prostate.
Okay.
So now he had to look at treatment options. So by God's grace, he was able to afford the brachytherapy, the one I talked about.
Okay.
And then they did that for him. And then so something that had killed my grandfather, the father, to the glory of God, he has overcome.
Yeah.
But yet he still has to be checking. So it's not like he didn't get the cancer, but he was ahead.
Okay.
So he used to check every day. So he was just going on and then making sure he wouldn't get. Likewise, my uncles as well. Yeah. So now it's like my big is above his 40s now, so he's also checking. So it's good to know your family history and be ahead of it. Okay. Yeah, it's very important.
So even though the age for the likelihood of prostate cancer is around 40, what happens when somebody as young as maybe 25 or even 30 notices something of the sort?
Yeah, like I said, 25, 30, prostate cancer, no. But
in an unlikely happening like that.
Yeah, so like I said, there could be other differential diagnosis. The BPH, that's increased prostate, mimics prostate cancer with the symptoms, you see. And you know, let me throw it out there, casual sex without condoms and just having sex, unprotected sex, exposes you to STIs. And these STIs, you know, affect the urethra in the male organ, whereby there will be infection. And when not treated very well, it leads to narrowing of the urethra, and then you notice some of them will say even when they urinate split, and then they say they'll give birth to twins. You should know you're at risk of, and those kind of things put you at risk of prostate cancer. Yes.
So it's more of STIs that.
Yes. STIs, recurrent infections, untreated infections.
Because I was asking because in a situation like breast cancer, we used to think that it's only for the older women, people towards the end of their lives, but even young ladies are getting breast cancer. So maybe there is also a chance that younger guys too.
Maybe it can, but it's very rare.
Well, considering the fact that there are also these allegations that cancerous cells are based on the foods we eat these days and things like that, so the possibility of that. So let's quickly talk about the prevention and then we wrap up. So what are some of the suggestions you would make as a doctor to the men out there as to prevent
every birthday? Just come and do your, and the men is simple. We the women, we now have to do a pap smear, open up, and they would have to do a vaginal swab to pick something, check the cervix. Yours is blood. Just make sure you check your PSA levels, and then your doctor says it's in good range, you are good to go. If it's funny, then we now have to do the scan and then the biopsy and all that. Just make sure you check. And then the stress, this goes to the women. I know men are to do everything, but I believe a strong, supportive woman helps a man. So you don't leave the whole burden on your husband. This is, by the way, but some women will say, my money is my money, and then
his money is our money.
His money is our money. So it puts extra stress on the man and then predisposes him to issues like this. And at the end of the day, you are going to lose your breadwinner. So why don't you cut off the stress and help them, make them eat well? The buying of food outside and things, they should eat well balanced meal, vegetables, a lot of fruits, you know, fluid, hydration, exercise. All these things prevent prostate cancer. But the funny thing is that if it's a family history, you can do all this and still get it. That's why I said just be checking just be ahead of the disease. It helps a lot. With technology and everything going on now, there are some diseases that you shouldn't die from.
So quickly, let's talk about somebody living with prostate cancer now. Maybe they've gone through the radiotherapy, chemo and everything. How is life for such a person, and what are some of the suggestions you'd make?
So like I said, my father-in-law was diagnosed when he was in his 60s. And he was treated, chemotherapy, radiation, surgery, and then he lived on to 85, but he recurred again. So after treatment and everything, you have good quality life in the sense that you can be okay, walk around, eat and all. But the only issue is with sex in terms of erectile dysfunction, which you need medications, and sometimes it affects the ego of men, and that can be a challenge. So you see, this kind of treatment is a whole multidisciplinary approach, whereby the psychologist has to come in, the urologist, the male urologist has to come in. Different doctors concerning, so it's so that it becomes a whole collective, holistic way of helping. So because it really affects them, it affects their confidence. When a man can't have sex because of medical conditions, it puts them in constant anger, irritation, and then they're always, all over the place because they are frustrated. So it's quite a very sensitive issue to talk about. So they need a lot of emotional support, psychological support, encouragement,
So with that, what can the men do when they have their egos dented and things? Because I know for the breast cancer people, some of them, you know, women, they create support groups
We are
and
just
things.
like that.
Yes. But with the men, what are some of the things available for them, or what do you know of that they can do?
So usually the men are not able to voice out their struggles. And you hardly hear prostate cancer men support groups. But what we advise is diversion, interest. So get a sport. My dad will do tennis, and he's so into his tennis, not because he's also had his own issues with prostate. So you see him playing like 3 times a week, everything to keep you going.
Yeah, but you see, with the sporting activity, yes, you have your mind off it, but you know how as human beings, sometimes we need to let out the emotion, the catharsis, vent. What about that aspect? Because at some point it will catch up to you. He goes to play the tennis and comes back home, and maybe your mommy is looking all yummy, but he can't exactly do anything. Much. Then it hits him again. Something like that. So that's the psychological part.
So this thing usually it's so surprising how when a man is diagnosed with prostate cancer, it's just not about the man, but the woman too.
Yeah.
We've seen cases where the woman is extra supportive to the husband, and there's kind of understanding between them.
Yeah.
It's not only through sex that a man can be okay or will feel good. There are so many ways to excite him. Yeah. So all these things it's not only one person. It's not only like one person who's gonna do the whole work. It's like normally when they come to the consultation, they come with their wives.
Yeah.
So there's this conversation we can have to let them know there are other options in ways that can make him happy. Not necessarily always just physically draining, having sex or something like that. So at the end of the day, it's quite a very sensitive issue. Yeah.
So do you know of any support groups for men that come together to help each other out?
Yes.
Outside Ghana?
Yes.
But not in our African setting.
Ghana. Yeah.
So we have a question here. It says, please help me. How do I check? Should I just go to the hospital and go into the consulting room and tell the doctor that I am here to check my prostate health?
Good.
Yes. It's
Exactly. And we will be so excited because I like people who come to me and they are like, doctor, can you check my liver, my sugar, my this? I want to examine my breast. I want to know my PSA levels. My cholesterol is high. It makes me so happy because it's like I know I'm not doing the work alone.
Yeah.
Because you guys will meet me halfway.
Yes.
Mostly such people have read a lot. So whenever you give them advice, they are quick to take the advice and then they get better results.
Okay, so this one, I think we've answered the question already, but it says, what are the chances of getting prostate cancer when a parent or sibling or a child who has or has had prostate cancer? So as she said, it could be genetic, the BRCA gene 1 or 2, you could have one of those. So once you have somebody in your family who has had prostate cancer, you should be checking your PSA levels because you are likely to also be a victim. So she says we should just get ahead of the disease. So quickly, let's take your closing remarks and please admonish these Ghanaian men for me.
Well, they are doing well.
To take some proactive action for themselves to get checked.
So, most men don't like going to the hospital at all. It takes them to break down before you see them in the hospital. So you notice the male wards, personally don't like working there because they have very bad cases compared to the female. A female will come with malaria and she's rushing to the hospital, a female. But mostly male come with very comorbid issues. What our advice is that, please, the hospital is a friendly place. Just come, have your PSA test done. If it can't be done, we have services available now whereby we come to your offices to draw samples for you and then we interpret your results for you, or we come to the comfort of your homes. Now there are mobile hospitals. You don't need to come to the hospital. Just make sure your PSA is checked.
Okay.
Yes.
Oh, so I think it skipped me. Is the PSA test expensive?
No. So averagely, in a very good lab, we could have the price between 130 to 140.
Okay.
Yes.
Okay. So approximately 200 cedis, you should get checked. Hey, please, I'm trying to wrap up. Okay, we have a question here. It says, have you encountered any prostate cancer patient who was married and has been divorced? So I think this is linked to how when women develop terminal diseases, their husbands abscond.
Yes.
So in a situation like for the men,
so that's a very good question. So like breast cancer, you know, most of the time when we deal with breast cancer patients, about, let's say, 4 out of 5 men will leave their wives.
Yeah.
Likewise with prostate cancer, I've experienced that with a patient who the wife left because eventually, like I said, there will be problems sexually, and then it can affect the marriage and all that. But I mean, it's subjective based on a woman's choice. You can't force her to stay if she's not happy. But marriage is for better, for worse. So if the worst has happened, where are you running away to? So
well,
it's
the men have been running. So maybe some of the women think.
And it's so funny how, you know, the prostate comes in the latter age. You see, so in the middle, in their 40s and 50s, they are enjoying with women. They are okay. Then in their 60s, they find out they have prostate cancer. Now they can't have sex. Then now the woman is now showing her powers, and it's funny, you know.
Why are the questions now coming in? So this one says, "Good morning, doc. Please, I'm 29 of age and I'm always having waist pains. Is it also a symptom of prostate cancer?"
All right. So it can be a symptom. For 29 years, I don't think it's prostate cancer, but I think you check your lifestyle. Probably you're doing a job that makes you sit for long hours. So go have an x-ray of your lumbar spine to rule out spondylosis or something. But I don't think for your age is prostate cancer. But you can do your PSA test.
Yes.
Yeah.
Okay. Thank you very, very much. Now, I'm not taking any more questions. You had 1 whole hour to send questions. So thank you so much for joining us here and teaching us about prostate cancer. And I hope that you watching, you've also learned something. Educate your friend about prostate cancer. Even if you didn't hear anything, just remember to go and get checked for your PSA. Get your PSA test done. It's not the invasive one we've been seeing in the movies. It's a blood test. So just go to any medical facility and tell them you want to get your PSA levels checked, and then they will draw a sample of blood, even probably from your arm.
Yeah.
So don't have any misconceptions about this test, and you'll be fine. So this brings us to the end of the Cocoa Digest morning show. Thank you so much for staying with us throughout. A big thank you to our management, a big thank you to our technical team, to our sponsors, to everybody who contributed to making this show a success. A big thank you to Papa J and Papa C. We are most grateful to you. Now, this month is Prostate Cancer Awareness Month. That is why we had this conversation today. It is also PCOS Awareness Month, and we are hoping to have you back to talk to us about PCOS. I'm sure the women will be ready, all the fibroid issues, you'll have your questions. So we're hoping to have that conversation very soon. So stay tuned to Clock TV. We will be having that conversation one of these days on the Cocoa Digest morning show. So yes, this is goodbye. Have an amazing weekend ahead.
Clog TV. Beyond the policy.